My name is Elke Kellis and I'm one of the psychologists here at the Red Couch. The purpose of this little video is to assist you in the process of selecting a psychologist who's right for you. I think it can be very daunting when you're looking to work with a psychologist to find the right person for you. There's a lot of psychologists out there and it can be very hard to distinguish what their areas of specialty are and what their approach to treatment is. So I'm going to talk a little bit about the kinds of patients I work with in my practice and the areas of psychology that I have developed as specialties over the years, as well as the approach that I take to treatment, so that hopefully this video can assist you in that process. So I have been a psychologist for over 15 years now, and in that time I've treated a lot of patients with anxiety and depression. I think they are the most common mental health concerns that we see in our practice as psychologists. And even when a person has another mental health disorder, such as OCD or schizophrenia or post-traumatic stress disorder, often anxiety and depression can form part of that picture. So I'd like to think that most psychologists are well experienced in working in those areas. So in addition to anxiety and depression, which I do certainly see as areas of specialty for me, I work with a lot of patients on postnatal anxiety and depression. I work with patients on adjustment difficulties, adjustment to major life changes or difficult and traumatic experiences, as well as adjustment to chronic illness or chronic pain. I also work with a lot of patients on trauma, and that doesn't necessarily have to be childhood trauma or abuse or neglect. It can be a more recent traumatic experience. So I'm well experienced in helping patients work through those areas, and they're often uncomfortable and difficult symptoms that come with trauma. And it might be nightmares, it might be anxiety, it might be difficulties in relationships, but they're certainly the areas that I work with when I work through trauma. I work with patients on relationships, whether that is relationships with an intimate partner or with a family member or with a work colleague, and it might mean developing relationship skills or communication skills. I also work with patients on the relationship they have with themselves. I think sometimes we do go through major life changes and or traumatic experiences, and they can lead us to question who we are for ourselves and for other people. So sometimes we can get into periods where we don't particularly like ourselves, where we have low self-esteem, or where we are in conflict with ourselves, and there's certainly areas that I'm experienced in helping people work through. Sometimes major life change or traumatic experiences can lead to grief and loss. That can be a loss associated with a major change or the loss of a dear loved one. So I have worked over the years with many patients on grief or loss in certain areas of life. So the approach that I take to treatment in the first instance entails getting to know you really, really well. I keep a keen eye on what the research is doing, and I think it's important that treatments are up to date and kind of on the cutting edge of what the field of psychology is doing. But I think it's important to remember that the treatments that are included in the clinical practice guidelines that we use as a guide are not one size fits all, and I think it's important that treatment is customised to your particular personality and your needs at this time and your experience and goals for therapy. So getting to know you is a really important part of that process, and working collaboratively with you, working together to help you choose which treatments might be right for you. I see my role there as really as empowering you and giving you the information you might need to make a good decision about which treatments you might prefer. So I hope that this video has given you a little bit of an idea of what sort of work I do and how I work with people that choose to work with me. Thank you for watching. I hope that we welcome you to the Red Couch soon.